Hey guys, it's Nurse Gwenny. Let's talk about how we get a balloon pump on the helicopter. Spoiler alert, in my opinion, the most difficult part of transporting a patient that's on a balloon pump is lifting it up into the helicopter and getting it strapped down. But there's a little bit more we have to know about it than that. And of course, the balloon pump has two goals, and we've talked about this before. We want to improve coronary perfusion, which occurs during diastole when the balloon inflates and displaces blood backwards back up to that aortic root where the coronaries are perfused from. And number two, to reduce the workload on the left side of the heart, which is achieved when the balloon deflates, generates the slightest bit of negative pressure, so that when the left ventricle pushes during systole, it's got a little bit of that pull from the deflation of that balloon. But we need to make sure that that timing is correct. But the machines are so sophisticated now that if there is a timing error, it generally switches itself. If it was on EKG, it switches to pressure or vice versa. But there's a few things we got to keep in mind when we're transporting these patients. Of course, think about it. You've got this big hose going from this big machine in through the patient's femoral artery to hang out in their aorta. Well, we certainly don't want to kink that off by letting the patient sit up. And so when we transport them, we generally like to keep them pretty low, either supine or like 15 degrees up, because we don't want to sit them up and cause that tubing to kink off. One of the test answers, if you're studying for your CFRN or your FPC, is if you see rust-colored flakes in that helium tubing, because we're using helium to inflate and deflate that balloon, say 100 times per minute. If you see those rust-colored flakes, that means you've got a compromise in your balloon. Either it's ruptured entirely or you've got a little leak in there and you've got some blood floating down in there and it's drying, and that's what's causing those rust-colored flakes. And if that happens, we want to land and get this patient to the closest PCI capable facility where they can replace that balloon. And one thing we like to do before we load these patients up in the helicopter is we put a knee immobilizer on whichever leg where the balloon pump is inserted. Because again, if that patient, while they're on the cot, and it's not always very comfortable up here, if they bend that knee, that's going to kink off that balloon, just like you can see on the stripe of my flight suit. And we want to prevent that. And so we can do that by asking the ER, hey, can we have a knee immobilizer? And locking that knee in straight. So there you have it, a few tips and tricks for transporting an intra-aortic balloon pump.